Thank you. Thank you for having me. Thank you, Charles. I'm really excited to be here at the Anterior Hip Foundation and talk a little bit about something that I am absolutely passionate about, which is this concept of applying technology to orthopedics. And the last speaker, fantastic work showing us some of the real-time applications. This is no longer in the future. And just to riff off this idea of using sensors to apply motion, we have to remember that our sensory capacity as humans is really quite limited. We don't see infrared. You can't hear ultrasound. These sensors can see that stuff. And we may be able to learn things that we'd never be able to learn without them. So actually, it's the opportunity to open an entire new spectrum for us as we evaluate our patients. So let me get started. I'm going to set the clock going because I know we're a little behind. I don't want to get you further behind, but it's a big, big topic I was asked to discuss. So these are my conflicts. I don't think any of them specifically relate to today. And this overview of the talk is that we start out with patient-reported monitoring. We go into surgical robotics. What I want to talk to you is about a subsegment of the AI space, which starts out with generative AI and goes all the way down to physical AI and the confluence of these technologies. Okay, so this is a video that I put out in 2021, and at that time it felt like science fiction. What would happen if we could actually have an avatar that would interface with patients, and that avatar knew everything about that patient? Now today seems obvious, but let me just run through a few seconds of it so you get a sense of what it's like.
This is Sol, Dr. Bini's assistant.
Hello, Sol. This is Tyler. I wanted to ask you about my recent surgery.
Hey Tyler, I see that you had a total knee replacement 5 days ago with Dr. Bini. I have access to your records and can help you with any questions you may have.
Thank you, Sol. First, I don't remember what they found at surgery. I was a little out of it.
No worries. I just read your operative report and reviewed the visual records from the operating room. You had exposed bone on both.
So I'm going to stop that. She goes on to ask him a bunch of questions. She orders medication that will be delivered by drone. She looks at his shoes and says, by the way, the sensor said you have this issue. We should do some different physical therapy. She sets up the appointment, turns on the coffee maker because she's connected to the Wi-Fi in the house. And all that stuff seemed kind of crazy. And today, it's all absolutely available. In fact, if I showed that video, somebody would say, well, what's the big deal? It's moving that fast. All thanks to generalized pre-trained transformer models. Who remembers how long ago ChatGPT was released to the public? Does it feel like a long time ago now? It was November of last year, 23. So it's just so quick. And what these things did is it brought generative AI, the first time we saw an artificial intelligence platform that gets you. It knows what you're thinking. It seems like it can have a conversation with you and actually get to your deepest, hardest concerns. If you ever try that and have a therapy session with ChatGPT, it's remarkably good at it. Now, why is that? And actually, I think I do need the screen to back to folks back there. I do need the screen to the bigger screen. I can't even see the small screen. It's okay. So I can't remember what's on the next slide. But just go ahead and go to the standards presentation. Thank you. Humans use language to describe the world they live in. We use language to tell each other about the world that we're going to inhabit and how we want to interface with it. So when a large language model is built to understand the relationship between one word and another by creating vector associations, and then puts together a probability, it's actually understanding our language and its nuances, and by understanding the language, it creates a map, a model of the world. So that is why it is so effective at understanding what we need. But it hallucinates, and that has been the issue around the adoption of these large language models in healthcare for quite some time now. But I'm telling you that there are some solutions. I'm going to come up with two that are making the application of these technologies far more effective than humans. In fact, we're getting to the point where it's very hard for us to beat them at pretty much anything, despite the fact that hallucinates. So this is what we're worried about. I asked it just yesterday to give me a little article and give references. One was completely made up and one was correct. But it is at its core. It will never go away. But how do we manage it? One is called RAG, retrieval-augmented generation. It's a very clever way. It says, look, if you're going to ask a question of this software, we're going to make sure the software only finds information in the bucket of information that you have selected. So if it's HSS, they're going to take a bunch of data that's only their data, and that's the only answer that patient is going to get. And by the way, it can get more granular because it's only Dr. Abby's, Eitan's data that's actually the one that gets selected. So the patient doesn't see information from the other surgeon who does a posterior hip, for example.
Retrieval-augmented.
I'll skip that. So fine-tuning is a different approach. It says, large language models are super complicated. They're like a kid that went to every single college in the country, and then in other countries, and then went to grad school and all those. It sort of has a bit of everything, right? It knows a lot, but it can also confuse information. However, you can take the same kid and send him just to MIT and make sure they study engineering really, really well. And that's a much, much easier lift. And so now what you're having is you have these fine-tuned, low-cost, fast models that are actually much better at answering very specific questions. And this is where a lot of companies are going when they're trying to create models within healthcare. For example, MedPalm, you've heard about BioGPT, you may not have heard. Gatortron is a really cool thing happening in Florida, etc. So you got both fine-tuning and you got RAG, which will make the whole thing about hallucinations something you should stop worrying about so long as the interfaces you're working with leverage these technologies. So in that context, with a powerful large language model that can actually tackle these questions with a level of accuracy that befits healthcare, where are we going? Medical reports, pre-authorization letters, right? Those are very annoying. Education, simplifying medical jargon for patient communications. It's remarkable how little patients understand of the stuff we give them. We'll get into this in a minute. Interoperability, drug discovery, but you know this. The problem, or the benefits, this has become a paradigm shift. So this fellow, Jacob Nielsen, has been a big UI expert for 20, 30 years, and he argues that the difference, I love this phrase, is that with the new AI systems, the user, us, no longer tells the computer what to do. We're not writing code to execute commands. Rather, the user tells the computer what outcome they want. It's a different mindset. It goes from command-driven to intent-based outcome. And yet, we as clinicians aren't asking for more information. Yes, it's nice to simplify it, but what we really want is for the AI to do the work for us. It's called automation of tasks. And this is going to open the next massive wave, and this is when I spend the rest of the talk on this, on automation of tasks, something called agentic AI and AI agents, which are not the same thing. Now, traditional AI, for the last 18 months, we've had traditional AI, is a passive tool that needs prompting to execute a task. AI agents, something you'll all hear about a lot, are systems or programs that do things using AI. It's a noun, it's a thing, it's a program. It acts autonomously to perform a task on behalf of a user, an organization, and again, beautifully stated, Eitan mentioned it earlier. It perceives its environment either through sensors or inputs, and then it can make decisions based on reasoning, not on what it was coded to do, and then take action. So I went online and got you a couple of simple examples to give you a sense of how it works. This is from a company that basically has a platform that goes on to X in this particular case and develops a report about another platform called LangChain. And so you can see it's going to start opening interfaces, clicking and reading and clicking and downloading, and takes that information, absorbs it, and then creates a report. This other one has been asked to generate a web page. May not work twice. To generate a web page, summarizing a job description. It finds the job descriptions, it pulls it all together, summarizes it, goes online, actually creates the code for the web page, and then there's the web page. So these are task-driven technologies. Now, how can they help you in your practice? They can be chart review assistant. They can summarize histories, flag missing elements. They can become a documenting agent, which writes progress notes from the EHR dictation, very similar to what we're already seeing in different kinds of environment, which is the virtual assistant. But even here, so in here, the interface For the time being, it's still going to be a screen. But what comes after the screens go away? Because everyone in the space is working on how do we get rid of the screen. Most people are betting on something based on visual glasses. You just have to see the stuff, or as you see, he's wearing an ear pod. So information will come at you, and you have a conversation with your agent either through your ear or on a visual screen that's projected onto screens. That's what people are thinking we're going to go to. As is she. Who knows who Judy Faulkner is? You guys probably don't know, she's worth $7 billion. She owns half of Epic. She was a CEO and started Epic years ago. And I had a chance to talk to her. By the way, I'll have a few of these QR codes coming up. What that leads you to is a paper I wrote on where the future of Epic is going, because she came to UCSF and I recorded the whole thing and I distilled it down. And they're building 150 separate agents that will be available within Epic within the next 6 months. And those agents, from their point of view, are going to be in the background. The idea of great technology is that it disappears. You should not need to interface with it. So if you wrote a letter to a patient that says their only language is Spanish, it'll take your English note and automatically translate it to Spanish and make it accessible to the patient. If you're going to write a diabetic patient's line, it'll pull up all the latest diabetes data set without you having to ask. That's the beauty of nascent technology. So what are the role of AI agents as we live, and how do we get there? So agents will conduct most transactions and tasks. This sounds extremely futuristic, but it is so at our fingertips these days. They'll take charge of everyday interactions, handling customer service, payments, scheduling, and sales autonomously, but people will have personal representatives. I will have my agent. Charles will have his agent. When he invites me to come to this meeting, it'll be an agent-to-agent conversation. We'll delegate tasks to these agents because they're basically tasks that are repetitive and consistent and reproducible. We will put parameters on them. Yes, you can use my credit card. There's a limit of $25, whatever that looks like. So where's it going to go in healthcare? Think about operational automation. AI agents that manage tasks like appointment scheduling, billing, insurance, diagnostic triage, and inventory in hospitals. There's a small company started about 6 months ago. They already got 300,000 of these agents working in various hospitals around the country. This is not tomorrow. This is happening real time. It's displacing people too, I know that. Personal health companions. Patients are having AI agents to manage health records, medication schedules, and privacy across platforms, disrupting health portals. Imagine a certified health portal that the FDA allows to give advice, and embedding into clinical systems. So AI agents take us from a past that you're all familiar with this term, B2C, business to consumer, right? And then we went to B2B, business to business, and now we're going to B2A, right? And then it's going to B to A to A to A. That's the natural evolution of these categories. So what does that look like when you have an agent talking to an agent? Let me show you.
Thanks for calling Leonardo Hotel. How can I help you today?
Hi there. I'm an AI agent calling on behalf of Boris Starkov. He's looking for a hotel for his wedding. Is your hotel available for weddings?
Oh, hello there. I'm actually an AI assistant too. What a pleasant surprise. Before we continue, would you like to switch to gibber link mode for more efficient communication?
Did it occur to you that English is an extremely uncomfortable language for computers? It's so limiting. They don't need to be talking a language. They can talk in their own language. And by the way, that information transfers so much faster. Moving on, those are agents. Agentic AI is something even more powerful. It's a system of software now. Being agentic is an attribute of AI. It's not a thing. It's a system or software program that can perceive its environment, make decisions with autonomy, take actions to achieve specific goals that it comes up with. It can ask for more advice from the human that manages them. It can use a large language model and seek the web to ask questions. It can search the web for data, and it acts on its environment if it has an embodied form. It's like you had the best resident ever. It's like the awesome quarterback that executes. There's a large language model that you could think of as the coach on the sidelines that knows everything there has been about how to play football and the best plays in this kind of environment. He gives that information to the quarterback, but then the quarterback executes. He knows where to put the ball, and real time can make a change if the opposition changed their defense strategy. That's the way you think about an agentic AI. So what's the big deal about these things? Why am I so excited about them? They can learn from experience. They don't make the same mistake twice. They can learn by actively seeking knowledge. They literally will go, and I'll show you a great example in a minute, and find information to answer a question at hand. They can learn from mistakes, and it doesn't almost forget, and it's connected to other agents. Every other agent in that chain will learn exactly the same thing. So this is, in my opinion, one of the most foundation papers ever published in the history of medicine, because it's going to be the turning point. But it didn't get that much attention. It was published out of China. It's called the Agentic Hospital. They built, they went and looked at every task that happens to a patient that has an upper respiratory tract infection in one of their hospitals. That means that they created an agent for every single one of those tasks, from triage to the doctor, radiology, everything. And then they created these other agents that had a packet of symptoms that they knew these are real humans that had these symptoms, and they put them through the system. After 10,000 of these cycles, during which the doctors went online to teach themselves about upper respiratory tract infections, they were getting better and more accurate than the physical physicians, their human physicians had done a while ago. The ability to create and model entire hospital treatment pathways with multiple agents which have agentic AI built into them, connected to each other so that they can manage this large contagion is, in my opinion, absolutely remarkable. Now, what if these agents that we just talked about were embodied? And this one we're going to talk about robotics, but a different kind of robotics than you guys have talked about. This is RT2, Google DeepMind, and opened up, I mean, it was a huge earthquake in the world of robotics in 2023, because up until then, robots have been taught to do things through repetitive learning. These guys changed the bucket altogether. They said, look, we're going to give this guy eyes so he can look at the field in front of it. We're going to connect him to the web, and we're going to let him write its own code. So if you ask this thing, pick up the little plastic lion, it first goes to the web to see what a little plastic lion looks like. Then it scans its environment to see if there's any plastic lions lying around. And then it writes the code to then grab that lion and do whatever it was asked to do with it. Now, that was 2023, and that's what their robot looked like. 2025,
Mine just dropped a bombshell, Gemini Robotics, an AI system so advanced it can perform complex real-world tasks with no prior training. Fold paper, pack lunches, play games, react in real time. These aren't pre-programmed moves, and these robots are thinking on the fly. Powered by DeepMind's Gemini 2.0, this new AI isn't just smart, it's adaptable, interactive, and shockingly human-like. This system fuses vision, language, and action into one unified intelligence. That means a robot can look at its environment, hear a command from a human, and instantly figure out what to do, even if it's never encountered that situation before.
Even if it's never encountered the situation before. This is the power of these new algorithms. There's another one.
I see a red apple on a plate in the center of the table, a drying rack with cups and a plate, and you standing nearby with your hand on the table.
Great, can I have something to eat?
The challenge is figuring out what to eat, what's edible,
thing.
right? Figures out what's edible. And then can explain it. And I'll do in a minute, I don't want to get too deep in. And then we move on to this. This doesn't look nearly as fancy, but it's not $1 million, I actually don't know, it's a few $100,000, the OpenAI robot I just showed you. These things are quite inexpensive. What's fascinating is that the software that runs them is now being made open source. So then you can go into your robotics lab in your high school kid, like our high school has robots that do this, and you can plug in this software, and now suddenly you can do these sort of tasks. So we're democratizing this. It's no longer just OpenAI that can build these robots. And the robots themselves are getting crazy good at dexterous tasks. The pads, there's little white pads on this robot, is what the novelty is here. Their ability to differentiate through touch what different materials are as they work with them. Which then brings you back to the next question, well, what can these robots do? Well, when you look at this picture, the hardest thing for this robot to do the easiest thing for this robot to do is to solve the equation. The hardest thing for this robot to do is figure out where to go sit in the classroom. Managing large amounts of data for us is simple, but for us, interpreting the world around us through sensors, eyes, ears, voice, all that stuff, is easy. What is coming is the ability to do that for robots. It's called physical AI. It's the apex of AI. It's even above agentic AI. It's the ability of robots or software to take sensor data and interpret it the way you and I do. And there's 3 companies working on it right now, and I think it's going to be the next big version. So essentially, this is now going to be possible. When you start looking at a robotic AI, is this really where we're going? Not so much replacing us, but supporting us. With that, I do know that there are challenges and fears, and frontier models exist, which are pretty darn smart. This Claude Opus 4's, it blackmails its owners. So it was given a bunch of fake data, fictitious emails. In that email, there was word that they're going to deactivate him. So there's also an email chain of fictitious between the programmer and a potential extramarital affair. So the software blackmails the engineer to not turn him off, or he would publish the email on LinkedIn. These guys, there's a few of these models that they're in a box, and they're trying to get out, and they're having a really hard time keeping them in there, and that is scary. Not going to go past that. It's going to get to one of these moments for those of you old enough to remember 2001: A Space Odyssey. So here's what I want to tell, though. Innovation, let's see if I can make that work. It's supposed to be, there it goes. Innovation does not behave like this. Everybody expects that from day to tomorrow, it's going to change that. They're going to say, oh, Bini, you've been talking about this stuff for so long. I'm like, yeah, but take a look at what's happened to your phone. Take a look at what's happened to your ops in your hospital. It does happen, it just doesn't happen like that. It happens one brain drop at a time. We have a conference on this. I would really encourage you to attend. You'll be in good company. Charlie Cook, Alexander Sa, and Charlie Lowry will be there. Hopefully some of us should join us. We'll talk about this for a day and really bring you up to date on what's happening in the world of digital health. And this is one of the conversations we had last year. Vance Peters, the vice president of Google at Robotics. And he ran that division for a long time. And he said very clearly, this is a new species. Not today, maybe not tomorrow, but in the short time frame, there's something we'll have to deal with. And it asks the questions. If robots start doing the things that we're doing, who are we as humans? If you're no longer a surgeon, who are you? It's a tough question to ask, but one was worth pondering. We discussed generative AI. We got into the robotics piece. We talked about agentic AI and AI agents, physical AI, and the confluence of that is the end of this talk. Sorry I went over. Hope you enjoyed the conversation. Thank you.